Okay, so chapter 3 is about patient management. Learning objectives for this chapter will be to define the key terms in this chapter, discuss the importance of understanding patient needs, including a discussion about Maslow's hierarchy of needs and Carl Rogers' client-centered therapy, describe the concept of locus of control, identify barriers to patient communication and the importance of recognizing nonverbal cues, explain how improving verbal images in the patient's mind can allay fears and identify phrases that promote successful patient management. Discuss the special needs of patients and their inherent rights, as well as ways to recognize abuse. Describe how to manage difficult or challenging patients. Discuss reception room techniques, including the role of the receptionist and reception room appeal. Discuss the contents of an office policy and design an office policy statement. Explain marketing techniques in dentistry. Describe internal and external marketing. Okay, so the most important person in your dental office is the patient. Never overlook the fact that every patient has a different background and different needs, and you need to be able to recognize those needs and go through whatever it takes in order to meet those needs for your patient. The dental team members have to convey a helpful attitude as they alleviate patients' discomfort and they provide educational services. Sometimes the dentist and the staff could be discouraged if they try and fail to attempt to motivate that patient, um, because usually what's happening is they're not reaching that patient and giving that patient what it takes to motivate them based on what they need, right? Like if you're talking to a teenage boy, he doesn't care about the bacterial process. To him, his teeth are never going to fall out. But if you talk to him about maybe halitosis and how that could be, unattractive to, someone he might find attractive, then you could motivate your patient better. But in order to do that, you have to understand what motivates your patients. Then each staff member who comes in contact with the patient should have a of what basic understanding of the basic drives involved for motivating those patients. So Maslow's hierarchy of needs, you'll see this one in figure 3-1 in your textbook. There are 5 levels of needs, which range from basic biological needs to social or psychological drives. You have to meet the lower needs first before you can move up in the pyramid. Relating to the hierarchy in dentistry means getting to know the patients and finding out at what point in this pyramid that they are in order to bring them up to self-actualization, which would have them setting goals. If they have esteem issues based on, their teeth, then you need to correct this issue before we can have them move on to self-actualization. Um, One of the best lessons that can be learned from Maslow's theory is that the individual has a choice in determining their behavior. And so as they travel up the pyramid based on their own life, they get to choose where to go with each of these tiers. So, Carl Rogers has a client-centered therapy, um, and he develops this to understand human personality and human relationships. So he is an advocate for client-centered therapy, believing that it is the client who knows what hurts, what direction to go, what problems are crucial, what experiences have been deeply buried. So basically, what that means is you have to understand that patients are whole human beings. They're not numbers, they're not case studies, they're not research projects, they're not pro fees, they're not perio maintenances. They are people. And you have to understand that in order to understand what drives them to improve. And once you understand what they need, how they feel about things, whether or not it is how you feel about things, you'll be able to motivate that patient. For instance, I had a patient who was very driven aesthetically. He wanted really white teeth, but he wouldn't floss. He would not floss. He would come in every 3 months and tell me that I'm the one who flosses his teeth. Don't tell him about the pockets. Don't tell him about perio. He just wants uh, clean white teeth. And then I had a moment where I was like, look, it's my job to tell you these things. I have to tell you about the pockets. I have to tell you about perio. And so I was like, just let me do it one time and I won't bother you with it anymore. But this is my job and you need to let me do it. And so he's like, okay. And I basically just explained to him that he might like white teeth, but when he's 60, those teeth are going to fall out because he isn't taking care of them. And I was like, bleeding gums are not attractive. And I got through to him, but he was someone that you needed to be really upfront and shrewd with, and so that's the route that we took based on who he is. I was able to reach him that way, and it's not always going to work that way, but listen to your patients for what they're telling you that they actually need, and then find a way to make those goals meet the things that you're recommending. The locus of control is a concept where people feel either they have control over the things that happen to them or they don't have control. So, an external locus of control is the belief that life happens to you, and an internal locus of control is the idea that you have control over what happens to you. So, if both of these individuals were in a hurricane and they were sitting on their roof, someone of an external locus of control would be sitting there thinking, this hurricane happened. I had no control over this hurricane. I have no control over the fact that I'm now sitting on a roof in the middle of a hurricane. Um, an internal locus of control individual would be sitting on that roof thinking, if I had evacuated or I had, maybe watched the news station, then I would not be sitting on a roof in the middle of a hurricane. They take ownership, they take control, they had control over their situation. The common obstacles for patient communication are they're also called barriers of communication. And the common ones are prejudging a patient, hearing but not listening to them, or being preoccupied. So, prejudging a patient can involve assumptions about their socioeconomic status. Maybe you think they're poor or you think they're rich, and so you're going to treat them a certain way based on what you think. It could be the way the patient dresses or the type of car that they drive, and you should not be doing this. If you think certain things about that patient, you need to consciously be aware of your bias and do what it takes to not act on those judgments. Prejudging a patient can also happen with disabilities. Sometimes we see patients who are in their 90s and we have this urge to talk to them like they're children, but you will very much offend an individual if you do that, but they don't appreciate it. So I would be careful. Get to know the person before you do things like that. Um, all communication should be directed to that individual with the disability, not to anyone who accompanies that person. Another barrier occurs when you hear, but you don't listen. So don't just listen to the words, you need to listen to the meaning behind those words. Meaning, if your patient is saying that, they're embarrassed to do something, they don't want to do it because they don't feel like it would make a difference, then you need to understand the meaning behind what they're saying. They're not saying they don't want to brush because they don't want to have nice teeth. They're saying they don't want to brush because they feel like it doesn't make a difference. And that's where you step in and you show them the difference that it makes. Restate what is said to you in order to make sure that the patient knows you understand. So if they say, I don't want to come in 3 months, I'm going to come in 6, and you say, okay, I hear what you're saying. I've recommended a 3-month recall, but for such and such circumstance, you want me to schedule you for 6 months. Is that correct? And they'll say yes or no. Preoccupation is something that happens a lot in dentistry because you will be busy. And so sometimes you'll be doing something else while the patient is talking to you. And that's not a good thing. Okay, so if they're saying something, you need to stop what you're doing and actually listen to them. Watch them while they talk to you, because again, those nonverbal communication, those body language, that plays an even greater role in communication than does their actual words. Additional barriers include like impatience, a lack of awareness, or even hearing loss, unfortunately. Gestures will give a lot of insight into the patient's reactions. So there'll be some nonverbal cues, which also are called gestures, are body movements that will tell you about what that person is dealing with in that moment. Care should be taken not to mislead one gesture or a series of gestures. Inaccurately. So you want to be careful, if the patient has their arms crossed, it might not be because they don't want to pay for their services. It could be because they're cold. Okay. So try to pick up on what's actually happening and not just what you think might be happening. Again, this book is written for assistants. So this is you. This is an alert hygienist is able to pick up on nonverbal cues and interpret them while communicating with the patient. Okay, so some of the nonverbal cues that we might want to keep an eye out for would be maybe when a patient grabs the arms of the chair or clenches their fist, they'll be sweating, or they might even start to hyperventilate whenever they get nervous. If they are defensive, they might cross their arms or clench their fists. This can also occur sometimes if they feel like they're being ignored. Um, if you want to show openness, you can like touch them on their shoulder or their arm like really close to their shoulder. That's really the only place it's ever appropriate to touch your patient. And even then, if they're wearing like a tank top, I wouldn't touch them on their bare skin. Um, Openness is going to be that they have this equal eye level. They meet you, they make eye contact with you, and there's no desk or authoritative posture. This happens a lot when you're with them. You like sit them up, you're sitting in your chair, they're sitting in the dental chair, and you're on that even playing field with them, and that is going to really help to build trust and openness. Embarrassment would be like their hand covering their mouth or avoiding eye contact. Sometimes during, oh, I'm sorry. So this is all in figure 3.2 through 3.9 in your textbook. You'll see a lot of these images. So it is a health professional's job to, or their job and their obligation to allay fears, or to allay means to reduce the fears, right? To comfort patients by creating a good image in the patient's mind. So in this, you don't want to use words or phrases that will bring up negative thoughts. Don't say the word, we're going to give you a shot. You might say, we're going to numb you up, right? Because the way we say it will help your patient feel differently about it. And you want to be positive in your responses to your patients. So anytime that they are worried or upset, and they're relaying those fears to you, you want to tell them it's going to be okay. The dentist is fantastic at what they do, or I'm going to be very gentle. I'm going to be very mindful of those areas. You'll see me in clinic talk to your patients a lot about how do you have any areas that are sensitive, and they say, oh yeah, I have this area, and I'm like, okay, well, she's going to be really careful around that area, but also, if you feel uncomfortable, don't be afraid to say something. And knowing that you're aware of that, they're there and they're feeling and they have sensation, and that they have a right to tell you that they're uncomfortable, is going to help them. A lot of people will suffer in silence. So you want to, I know it makes sense to you. Like if you're hurting, people would just tell you that they're hurting, right? But not everyone does that. So make sure you tell them, hey, if something hurts, tell me. Okay, I want to know. And whether or not they actually tell you at that point, either way, they feel like you care about how they're feeling. Patient rights. So the most important person in the office is the patient. Don't forget that, okay? You want to be considerate of the patient as a human being rather than just a subject of a dental procedure, right? So it's not that I have a prophy at 2 o'clock. It's I have a patient at 2 o'clock whom I will be performing a prophy with. Um, don't forget that dentistry is a healthcare profession. We are providing services in order to improve health. Members of the dental team cannot afford to neglect a patient's rights. So if you neglect a patient's rights, they can sue you and it will probably shut your office down. Things like that are very serious. And then take time to recognize the patient as a person. When the patient comes in and says that, they're busy, ask them what they do for a living. Ask them how many kids they have. Like, talk to them about their life, so that they recognize that they're here, and that that they're a person. Managing a patient with special needs. So, Americans are protected when they have a disability, as of the Americans with Disabilities Act in 1990. And it prohibits the dentist from discriminating against a person who requires dental care. So you cannot just turn patients away for no reason. Okay. If a patient does something wrong in your office, you can refuse to treat them, but there is a whole process for how to dismiss a patient from your office. You cannot just say, hey, you can never come back here again. Okay. If the patient is disabled, you cannot dismiss them unless they've done something wrong. Okay. So, just because it might be difficult to see them or it might be uncomfortable for your team doesn't mean you get to get out of it. So you still have to see these patients. If they are able to get to your office, then you have to see them. Recognizing abuse. So it's a dentist's job to examine the patient thoroughly, right? And to ask questions when they find something that's wrong. So just like with your, EOIO, you're going to be looking for things that would indicate whatever it is. If it's a sign of abuse, then you need to ask questions about it. If you feel like there is a possibility of abuse, there's a good possibility, then you need to report it. You have to report it. Um, and if they physically say it's abuse, then you have to report it. Abuse is pretty evident in today, like in most of them are child abuse or older adult abuse, like elderly. If you see a case of it, you are obligated to report. Each year, more than 3 million children are abused or neglected by their caregivers, relatives, or strangers, and more than 11,000 children will die annually because of that abuse. So, if you are the person who can interject and break that chain of abuse, then you need to be that person. Okay, like if you're able to be them, you need to do it. In abused children and adults, the signs of neglect will be an abnormal fear, like of being touched, um, or evidence of extraoral, intraoral anomalies, which we have talked about before, but things like bite marks or scars or lacerations, fractured teeth, burns, or bruises. In a lot of states, not reporting, the failure to report suspected abuse is a misdemeanor because it is your obligation to report. Difficult patients. So sometimes it can be difficult to communicate with your patient, and to determine what the issue is. Every chance you can, you need to try to resolve that issue. If possible, you'll choose a good time to discuss the complaint with the patient. You'll listen to that patient and you will be understanding. You'll be empathetic. You will not become defensive. And you're going to acknowledge that person's feelings and you're going to thank them for expressing those feelings. If the issue is a complaint about a service or a staff member, you're still going to listen, whether they're right or wrong, and you're going to explain how you'll deal with the problem, and you're going to seek to apologize so that treatment can move along. So, if they're complaining about how the hygienist ran late, then you'll say, I'm really sorry that that happened, and I will make sure that in the future we don't run late. If the person has done something so terrible that it would even warrant terminating an employee, then that is something that would come up kind of on its own. But it would probably be a pretty big thing for it to warrant getting fired over. Um, and then once you have resolved the issue, then you need to write it down. You need to store that in the patient's chart or in the personnel file whenever there's a conflict like that. There, you could always create a monetary policy for the office and to be certain that the patient is aware of the fees in the beginning so that they don't feel like you've changed the fees. It's always a good idea when you give someone a treatment plan that you tell them how much it costs right from the beginning before they ever agree to it or not. They know how much it costs. So even as you're going, if suddenly they're like, wait a second, this costs more than you said it would, like, no, here it is. This is the treatment plan. This is what I gave you. This is what it costs. You're going to follow through with the agreed upon plan. And then when changes have to be made, you have to inform the patient and then you have to get consent. But always document. All right, so now we're going to talk about the reception room or the waiting room, right? The role of the receptionist. So there should always be someone who has an eyeball on the waiting room. People who come in need to be greeted. In many offices, the administrative assistant is the person who greets the patients as they enter that office, as they enter the office, sorry. Although sometimes, there'll be like a specific receptionist and then there'll be like an administrative assistant somewhere else, unless you only have one. And then the receptionist should acknowledge patients immediately, either by their name or with a cheerful hello, and then they come up and then you ask them, did you have an appointment today? What was your name? It's not wrong to ask people what their name is. The positive image that's created by that receptionist should be a clean, well organized office. The receptionist should be certain that their clothing is clean. And that they look presentable. So again, you don't have to have a full face of makeup on, but you do have to look like you made an effort. The reception room techniques. So in a reception room, things should be bright and cheerful. You would never like paint the walls navy blue or anything like that. And then it needs to be pleasantly decorated. Things need to be simple but pleasant. There is no rule as far as the type of material that the chairs are. Typically in a medical office where people are sick, you have to have chairs that like you can wipe down. You wouldn't want like fabric chairs. But in a dental office, that is not as much of a rule because people don't come to the dentist usually when they're sick. Reading material in the office should be current. You should have the newest magazines or whatever you're subscribing to. And then you want it to be a pretty good variety there because you'll get, men and women and children and older adults. You kind of want a good range of things. Sometimes in some offices, you'll find that you can offer them coffee or tea or maybe another beverage. We don't do that too often in dental offices because you don't want them bringing their giant cup of coffee into the back where you're trying to clean their teeth. And then you have to tell them, hey, dump that coffee out. Um, and then if you're going to play music, it needs to be music that is soothing rather than something that's like hard rock or like a loud concert kind of music. You want it to be calming and soothing for all generations, right? I know newer music is nice, but you want it to be something that everyone can listen to and no one would be offended by it. Basically, when they walk in, it needs to be warm, it needs to be a friendly environment, and it needs to be relaxing. Also, in the waiting room, if they are going to have to be waiting past their appointment time, then someone needs to talk to them about it. Typically, it is the receptionist's responsibility to let patients know when there is a delay. And what you don't ever say is that the doctor is running late. Don't say this. This thing here, this is bad. What you're going to say is, it looks like it's going to be another 10 minutes. And you don't give them an option. It's not about, is that okay with you? No. If it's going to be a really long time and they seem upset, then you can say, I'm very sorry. Always, always, always apologize. A lot of conflict can be solved by just saying you're sorry. But you're going to say, I'm really sorry for this inconvenience. I absolutely understand. However, it is going to be another 15 minutes. If the patient, is like visibly upset about that, then you can say, if we need to reschedule, I absolutely understand. And there's not going to be like a fee for having to cancel the appointment. But you just talk to them. You're going to be honest about the time that they're going to have to wait, and you need to let them know that emergencies come up. People run behind. It's a normal occurrence. Office policy. We talked about this a little bit already, but the office brochure, a policy brochure, is the key in understanding between the patient and the office staff. So you'll have this, it'll have a mission statement, it'll have the dentist's philosophies, the policies, the responsibilities of both the patient and the office staff. So one, is that we have to provide services if you are, a paying customer, and you have to behave appropriately and blah, 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 right? The copy of the office policy has to be given to every new patient at their first visit. If you change your policies, you have to let them know. Typically, a lot of offices will offer this on their website if they have one. And then it's implemented from the very first day. When it's revised, you have to give them an update. Contents of an office policy, we've already talked about a lot of these, but the philosophy, the office hours, appointment control is going to be, you need to arrive such and such amount of time before your appointment. If you're more than, 15 minutes late, we're going to have to reschedule your appointment. If you cancel on us or, call no show, we're going to charge you 25 bucks. It just depends on your office. All of these are just random numbers. Payment policy, hygiene, they can't come disgusting. They have to wear shoes, they have to wear shirts. Attitude towards children. This one is more so if you work in a pedo office. Auxiliary use, this is if the assistant in your office takes the x-rays and then the hygienist is the one who does your cleaning. You're going to want to let your patients know. So when the person comes up to get them, you say, hi, I'm so and so, I'm the dental assistant. Hi, I'm so and so, I'm the dental hygienist. Let them know who the heck you are. And then infection control policies. A lot of patients, especially lately, they're very concerned about infection control. There have been enough breaches of doctors reusing needles. I remember when I first started, there was this huge case of a doctor who was reusing his needles, and everybody was like, "How do you do infection control here?" I had to explain it to everybody. Um, Quality assurance, staff continuing education. Every year at our office, we would shut down for 2 days, and we would go to continuing education, like a seminar, and I would tell people straight up, like, I can't schedule you on that day. We're going to be closed that day for continuing education. And they knew, they understood. Um, Office data, how data is collected, how data is shared, and all of the ways that you do not share their data. That's in the HIPAA policy. Most people don't, I mean, if they read it, great. If they don't, that's okay. Designing an office policy statement. So the office policy has two primary purposes. One, to build the practice, make sure everybody's on the same page, and two, to inform the patient of office procedures and the dentist's philosophy. So after that basic policy has been established, the administrative assistant can make the final draft, and that helps by designing several styles from which the dentist can make a final selection. Most of the time, that's like in the beginning of the office policy. That's not something you'll see when you're coming into an existing office. And then the final style, it needs to be attractive. It needs to be organized well. It needs to be large enough that people can read it. And it needs to be as brief as possible. You want to be succinct. Marketing. So dental practices have to use marketing to increase their practice loads because patients move away or they decide to never come back to your office or in some cases they will die. And so your office will constantly be losing patients over time. The office that I worked at had been there for like 25 years, and pretty much once a month, one of our patients had passed away because they were all in their 80s and 90s. So it happens. When I say that, I'm not being facetious. Sometimes they really do pass away. Um, it's usually a good idea to include an email address on the website so that the user can interact with the website. This is if you're using website marketing. There are other ways of marketing like radio or I've seen one where they print out on the back of like HEB receipts. Have you guys seen that? I think that's interesting. But there's tons of marketing out there. The internet is just one of the biggest ones, and then of course social media. A website is probably the best way to reach prospective new patients and to welcome and educate them and their families about your practice. A lot of times you'll put up photos about everyone who works in your office and things like that. Creating a website, you're going to need objectives for the use of the website. So you're going to need to know, can they make appointments from this website? Can they just read all about us? Can they just find our phone number? Are we going to put our services on here? All of those things. You'll create a logo or trademark. Usually that's already there when you open the office. You'll design the pages. Usually you hire someone who designs these pages. Um, Most of the time, the people you have working in your office can't design a website. You'll identify a web server. When you own a website, you own a domain, you do have to pay for it. And you pay like, it's usually like a couple bucks a month for something like that. Most people pay like all at once for 3 years and they have that website domain for however long. You'll upload pages to the server. You'll upload it periodically, right? As people move, or if you get hire someone new, or one of your employees moves away, things like that. Determine when and by whom the website will be updated. So if you have someone in your office who's pretty savvy with it, then you can have them update your website, or you can have like a marketing consult person who comes in, they do that stuff for you, and then they leave, and they're not like a regular employee. You can update, well, you need to update the website regularly to keep it current. I remember I worked in an office for like a year, and they kept my picture on the website for like 3 years after that. And I every once in a while I would go and look and be like, oh yeah, I'm still there. Every time I Google myself, it would be there. One of the most popular has been social media. So social media is one of the biggest ways to market an office now. The website should be you oriented rather than I oriented. So it should be all about the things that we can do for the patient, not for that the patient needs to do. And then the dentist needs to create the logo. That happens beforehand. Yeah, I think we're marketing, attitude, opportunities, practice ambassadors. So, employees need to have an enthusiastic attitude, right? We talked about that. Patients can pick up on the fact that you're not happy to be at work. The single most important marketing tool for an office is enthusiastic staff. When people come in, if they feel like you're happy to be there, they're happy to be there, and they're going to tell other people who want to come and be happy to be there. You're going to take every opportunity you can, to refer your patients to that website and get the word out about that practice. On social media, you'll be asking people to like and share things. You'll host events on social media that will get people involved. Anything you can do to get more foot traffic on your website will bring more people in the door. Um, and then sometimes it says oh, no, this says each member of the staff is expected to be an ambassador for the practice. It means ambassador is like more of a thing now, I guess, with like brand ambassadors. I actually just learned about this concept, but um, you're an employee there. You need to represent the practice effectively, and you can't say bad things about your office while you still work there. Okay, that's not being a good ambassador for your practice. Okay, there's internal marketing and external marketing. Internal marketing is going to be things that you do to keep people in your office, to keep them from leaving, right? You've got them in the door and now you need to keep them. So those will be like follow-up calls, having a clean office, being like having an attractive Attractive means like it's pleasant to be there. Discussion of problems if they have them. Staff identification. This, yes, it is wearing name tags so people know who you are, but also you introducing yourself. Staff interrelations, they'll pick up on the fact that you're fighting with the other people. Staff enthusiasm, they know if you're happy. Timely correspondence, so if they call your office and you don't call them back, they're going to be really mad at you. Thorough presentations, if you are doing things uh, um, like teaching them about the types of treatment that they need, you're going to need to be thorough, right? You're not going to, there's no surprises in all of this stuff. Bouquets, gift certificates, lottery tickets to patients. This is something that, like, incentives that they do, like if you buy whitening, you get entered in a raffle kind of thing. That happens, although it's not something you have to do. Theme open houses. I knew one office that would set up their office like a haunted house, and patients would come in and they would have to like go through the haunted house during Halloween. So I don't know, I think stuff like that's really cool. And then like dressing up as an office for your for Halloween is a big thing. Um, Good telephone manners. So when they call and they talk to you and you slow down and you take the time to talk to them, then they're more likely to come into your office and stay a patient for you than they are if you put them on hold and then you never call them back. Website, dental health newsletter, professional appearance, all of this stuff. Unrushed competency is a big deal, okay? Don't act like you have somewhere else to be. Even if you do have somewhere else to be, don't let them know. External marketing ideas are ways to get people to come into your office. Of course, right? Internal, keep them. External, they're outside and you need to bring them in. So these are with office tours, with lectures, directories. Lectures are like giving continuing education classes. Directories, a building sign, business cards, greeting cards, media advertising, open houses, website. Website's probably like the number one. And then eventually, I'm sure this book will add in social media, patient newsletters, neighborhood newsletters, and postcard mailing. You'll find a lot of times there'll be people who come by marketing in your office and they want to like leave a stack of cards in your office. And you're like, what? And it's because you get probably 20 to 30 people who come through your office every day and they stand there at that counter. And if 20 to 30 people take a card and only 1% of sales are successful, then they'll get somebody out of you probably once a week. Key to successful external marketing is to determine prospective patients and the best method to attract them. Okay, so newsletters as marketing. This really isn't done as often with newsletters um, as much as it used to be. Email, if you do email, I actually run the Constant Contact for San Antonio Dental Hygiene Association. So I make newsletters like this that I send out to people's emails. Not everyone reads them, but I think they're a really cool tool. And then you can have like little buttons where people click to access whatever the material it is. It's a wonderful tool when you have something like Constant Contact, which is super friendly. It's super user friendly. But they're not talking about like printing in the newspaper. Okay, if you have any questions about any of this, please let me know. And yeah, the only requirement you have for this week will be that discussion board, which is due Wednesday before midnight. And yeah, that's it.